1.
Hi, and thank you for joining us for MindRight AmeriHealth Caritas, DC, meeting the behavioral health needs of underserved youth. According to a Pew Research study, approximately 1 in 3 households with kids between the ages of 6 and 17 years old, with incomes below $30,000 a year, do not have a high-speed internet connection. This broadband access issue is especially acute for low-income Black and Hispanic households and represents just one of the many factors entrepreneurs must consider when trying to serve this population. While these issues were present long before COVID-19, this pandemic has increased the awareness of disparities in access across a variety of factors and pushed the need for solutions that better serve vulnerable populations into the forefront. My name is Allyson Plosko, and I'll be the moderator for this panel on how a collaboration between a DC-based Medicaid plan and an early-stage company is working to meet the mental health needs of vulnerable youth. I work at Benaj, where I'm the director of Telosity, a fund launched in May of last year to invest in pre-seed and seed stage companies improving youth mental well-being. I'm thrilled to introduce my panel members, Ashley Edwards, founder and CEO of MindRight, which is also a Telosity portfolio company, and Dr. Yavar Moghimi, Chief Psychiatric Medical Officer at AmeriHealth Caritas, DC. Ashley Edwards is a Forbes 30 Under 30 social entrepreneur and serves as Impact Co-Chair of the Global Forbes Under 30 community. Her thought leadership and social innovation resulted in the magazine naming her as one of the top 30 healers set to influence the next century. Dr. Yavar Moghimi has extensive experience working with Medicaid populations in Washington, D.C. as a managed care executive and community psychiatrist. He has a track record of innovation when it comes to bridging gaps between behavioral health, physical health, and social services. Both as an administrator and clinician, he's intimately familiar with the current challenges our fragmented health system faces and has implemented multiple interventions that address the social drivers of health, complex populations with comorbid substance use conditions, and improve transitions of care. So welcome to both of you.
Thank you.
I am so excited to be discussing this topic that I know is really near and dear to all of us with the two of you who both bring unique but really complementary perspectives to this issue. So if it's all right, let's go ahead and jump in with our first question. So this one is actually for both of you just to help provide some context to audience members who might not be as familiar with this topic area. And the question is, where do you see the gap for underserved youth in accessing mental health support services?
You can start, Ashley.
Okay, thank you. So at MindRight, where we see the gap is in 2 primary areas. So first, there's a huge lack of supply when it comes to providers that actually reflect the diversity of the communities that we're trying to serve, especially in underserved communities where there's historic distrust of service providers and a real amount of stigma. And so that's one area. And then also for us, we see a lack of support between crisis support and just daily emotional support. So there's a lot of crisis and therapeutic interventions, but as a space, we have yet to kind of fill the gap of just, when someone is having a tough day, where they can go for support and really considering upstream interventions for mental health and behavioral health. And I think there's a lot of exciting opportunity there, especially when you're looking at non-clinical interventions, again, more preventative focus, specifically geared for this population.
Yeah, I think everything that Ashley said, really echoes why we ended up forming a partnership with MindRight in that, particularly working in an urban Medicaid space where we found a lot of solutions are not really being, tailored towards our membership. We really wanted to find a vendor and providers that have that cultural competence to know what the needs of our members are and how to meet them where they're at. I feel like there's a lot of where we're trying to fit kids into a mental health box as opposed to having the mental health and wellness fit to their needs. And so looking at these non-clinical and more virtual, non-office-based kinds of services that are prevention focused, even though we don't necessarily bill for prevention in the Medicaid space, there are ways we have some flexibility in the Medicaid managed care space to, be more innovative and try to find partners that can help us work in that space.
Yeah, that's really helpful. A couple of follow-up questions for you, Dr. Moghimi. Given your vast experience working with Medicaid populations, are there unique challenges related to deploying solutions to underserved youth that you feel are often overlooked in new solutions?
Yeah, I mean, I'll highlight, I guess, one of the challenges I was witnessing, as our behavioral health medical director, and seeing that there was, time and time again, I was seeing members of ours that were being hospitalized for a psychiatric reason. And I would go into their claims history and look and see what level of engagement had they had in behavioral health before getting hospitalized. I mean, a lot of times these kids maybe had made a suicide attempt or something like that, and they were getting treatment. And too often I was finding that there was no outpatient behavioral health treatment, no history of medications, no history of therapy or anything like that. So clearly our existing mental health space, outpatient providers were not being offered, or maybe they were, and they were not seen as appealing options to these teenagers and young adults. So really trying to think about what would be solutions that meet them where they're at, and recognizing that, many youth are not looking to providers. They're looking to things like social media. They're looking to their networks. They're looking to their schools, to their teachers. And how can we figure out ways to have solutions that are in spaces where they're already engaging, as opposed to trying to force them into a behavioral health space that they may not necessarily be engaging in.
Yeah, I like that idea a lot of meeting them where they already are, and trying to look for solutions in that area. So I'm curious, what kind of interaction does AmeriHealth Caritas DC typically have with early stage companies? And, any advice that you have for startups out there that might be listening right now when approaching folks like yourself?
Sure. Yeah, I think it's important to not, when you think about payer groups in particular, to not think of them as a uniform entity. I think there is, usually there's an enterprise level of product development and strategy, and then there's a more local based on the line of business. I mean, me working in Medicaid space, we're talking about the state Medicaid contracts where we're connected, and each state sort of has their own focus and their own nuance for what is their priority. I mean, I will say in DC, school-based mental health services has been a priority of the mayors, and is something that we have worked to put in place through our existing provider network. But I think there's more opportunity for innovation and risk taking, I think, on a more local line of business level. And it depends on really the leadership and the vision of who you're working with. So I think the key for any startup is to really look and see if they can find the champion on that plan level. It's unlikely that many on the enterprise level that it would probably be more of a challenge, I think, to adopt earlier startup, especially if they don't have a lot of proof of kind of ROI to bring to the table up front. But the other thing I would say is that there is it is true in DC, and I'm sure in other jurisdictions too, that many of the Medicaid contracts may have an expectation of supporting local small businesses as a part of their contracting and subcontracting. So it may be that if it's where startups should look probably locally first in terms of where they're located, and are there local partners, whether it's a health system or a payer that is able, because there may actually be contractual things that require them to help support small businesses too.
Yeah, those are all really, really helpful points. So Ashley, I want to turn to you because you obviously saw a gap in this market. So I'd love for you to talk a little bit about why you ultimately started MindRight, a little bit a little bit about the model and why you chose that particular format.
Yeah, absolutely. So before I founded MindRight, I was actually working in education here in Newark, New Jersey. And I worked at a charter school, a high school, where we had one part-time social worker for hundreds of kids. And we were working, and I was also living in an environment where there's just such pervasive trauma and adversity at such an early age, having young people coming to school after being impacted by mass incarceration, just surviving poverty on a daily basis, living in food deserts. And all of these social determinants of health show up not only in school, but also just in their well-being. And so after seeing all this happening and the clear lack of support at my school, I realized it just wasn't a my school problem. It just wasn't a like Newark, New Jersey problem. It's everywhere. And so I began to ask myself questions like, how can we create a solution explicitly designed to meet the needs of this community, and not just as an add-on or like a DEI or a CSR initiative, but how can this be the main thing that we do? And so I saw a couple things. So first, I saw a lot of a success of text message-based interventions in low-income communities, whether it's for follow-ups for doctor's visits or for financial literacy. And then I also saw, you know, given the huge stigma around mental health in low-income groups and communities of color, you know, where are people going for support? And right now, there's a huge informal networks of support in these communities that are often not highlighted, whether it's the basketball coach that is kind of an impromptu therapist for a kid, or a favorite teacher, or a pastor. And so we really wanted to create something that, like Yavar said, met people where they are. If people aren't ready yet for clinical support, that's okay. Let's meet them in a way where they feel comfortable opting into. So for us, that was a coaching model in a space where they feel safe. And for young people, that was texting. And so that's kind of how we got started. And we've been fortunate to have young people texting us back and sending thousands of texts, and really grateful for that.
Yeah, and I want to just dig into that a little bit, because you mentioned something to me several months ago that I thought was really interesting on why you went with the text messaging versus an app. Can you talk a little bit about that?
Yeah, our goal is to make this as accessible as possible, and the lowest common denominator of that is SMS texting. What I find is when, in my personal opinion, when a lot of interventions are designed, we love complexity, but it's actually the most simple solutions that usually have the highest engagement and success. And so just want to create something super simple. And a lot of times, you know, young people have all the apps, everyone's creating apps, but how can we make something that works, especially for Medicaid populations, given the nature of just the challenges they face? So that's why we chose the SMS.
That's great. And so then if I am, if I'm a teen, can you talk a little bit about where do I learn about MindRight, and then what's the user journey that I go through?
Sure. So we love to partner with Medicaid managed care organizations like in AmeriHealth in DC, also school partnerships. So generally you might find out about us from one of those two different types of organizations or community-based organizations. And since it's not an app to sign up, all a young person has to do is text our number, make it super easy to get support. And then once you text us, you have the opportunity to receive daily check-ins with your coach 7 days a week, 365 days a year. So really, like when we were designing this, we wanted to create a way to remove as much burden as possible from the end user. So you just sign up once, and then we're proactively texting you every single day. So you just have to check your phone and respond if you feel like it.
Great. So I want to turn back to the partnership that the two of you have embarked on, and I'm curious to learn about the origin. So how did the two of you first come to learn about each other?
Sure. Yeah, I can talk. So I know in MindRight started out in DC as well, right? From their foundation in one of the incubators there. So, and they had built some relationships with DC schools, and particularly the schools where we knew we had a heavy concentration of our members. So so there was that kind of initial just sort of name recognition in the community, and I believe they sponsored one of our community events that was focused on adolescent behavioral health. So I think that was the first time I actually met Ashley in person and kind of talked through what they were offering, and really thought it was an innovative solution. So what ultimately led to us being able to take steps forward and offering this to our members was we actually were or are a participant in NCQA, National Committee of Quality Assurance, that sort of is the quality institution for all health plans in the country. We're a part of their adolescent depression collaborative. So as a part of that, we actually are sort of tasked to improve the screening and follow-up and remission and response of our members' depression. And as a part of that, there is some kind of seed funding to help with implementing kind of innovative projects. So I immediately thought back to MindRight and how we could work with them to improve, obviously provide their whole array of services, but to also improve, the more specifically depression screening and follow-up rates too.
Great. Ashley, do you have anything to add, or?
Yeah, I think
pretty much cover it.
I think Yavar pretty much covered it, but I think it's just been really great. I think this partnership has been a good demonstration of just relationship building and staying in touch until it's the right time to move forward.
Great, that's awesome. And so I know it's still very early and in the partnership, but I'm curious, are there any early successes that either of you are particularly proud of?
Yeah, one of the ways that we felt comfortable moving forward with partnering with MindRight too was we had established a youth wellness advisory council, also as a part of that adolescent depression collaborative, and actually, was able to work with Ashley to see if we could pilot this with this group. So we actually had some real-time feedback of our members and how they were using it, and so that I think really helped convince us that, getting that direct feedback from our members who are in the youth wellness, seeing how much they used it, seeing, the impacts it made on their lives. I can think of a specific member in that group that had recently had a teen pregnancy and was still in high school, was kind of not sure if she was going to continue her schooling or not, was initially thinking she'd go to community college, but then wasn't sure. And it seemed like after a period of time of engaging in MindRight that she actually was more convinced that she wanted to continue on with her education. And so that was kind of one example, even as we were piloting it. And then as we've had it more active, actually talking about, the level of adverse childhood experiences that, people in our membership, the Medicaid population can experience. There's been at least 2 situations where we, because of MindRight, have been very close to connecting folks who've experienced trauma, particularly sexual trauma, to getting clinical services that I think without MindRight, they may have just sort of been silent about this for who knows how long. And so to me, those are some pretty clear examples of how it's directly impacted our members' lives.
Yeah, and I would just echo that. And like, what makes me most excited is our ability to be uniquely positioned to make those connections and really be a bridge, because a lot of the people who text us are not very involved in their plan. They're not actively seeking services, and we often become like frontline care providers to them, in the sense where we're in a lot of situations like the ones that Yavar mentioned, we were the first people who they disclosed information or experiences to. And because we're in that position, we can then connect them to support or encourage them to seek support. And so that's an opportunity that we take really seriously and feel like really honored to occupy in supporting plans with really enhancing care coordination for hard to reach or disconnected members.
Yeah, that's amazing that you're able to intervene in those situations, and it's awful to think about what would happen if, you know, this service wasn't there, and where those kids could go, or would they go anywhere to get the help they need. So switching gears a little bit, I'm curious to hear how COVID-19 is impacting both of you, and how is it shifting, or is it shifting your priorities?
I think for us, I mean, I'm glad we've had this partnership with MindRight prior to all this, because I think it just highlights the need for these types of partnerships even more, because, you know, there's been a lot of talk about just telemedicine and the transition to virtual care during this time, and how much of that is going to be sustained. But I mean, I think even just going beyond that and really thinking again, what is the space that's going to be most convenient for our members to get the support they need? And going back to Ashley's point about the SMS and making it low barrier, I mean, I think right now when kids are sheltering in place and are dealing with the social isolation and are cut off that coach or that teacher or those people, those additional supports in their life, I think it just highlights the need of a tool like MindRight even more. So I think there's only going to be more adoption of these types of solutions, and yeah, so I think it's you know, accelerated a lot of the focus. And, you know, whereas before we were discussing this only on a plan level, I think there's now been more of an interest on our enterprise level. Oh, like maybe this is a solution we want to adopt enterprise-wide. So that's exciting to see.
Yeah, and for us, in terms of how COVID has impacted us, it's really had us just focus on ramping up and growing. I mean, we were fortunate to be like well positioned before the pandemic as a virtual support, and now we just want to be there to support as many people as we can through this as possible, while also, you know, really being there, especially for Medicaid populations that we were created to serve. Yeah.
Great. And so, you know, in 5 years, when hopefully COVID is long behind us, what is your prediction for how mental health care and support, specifically for underserved youth, how does it evolve? What does it look like in 5 years?
Yeah, I mean, I think there's virtual care is here to stay. I think there's going to be more and more innovation around that space. I think there's going to be more of an established payment structure for those types of interventions. I mean, even for things like text-based intervention, you know, I think whether it's through a capitated types of arrangements or through even just, you know, adoption of CPT codes that allow for those types of engagements. I mean, I think there's already been a movement towards more peer specialists or coach or peer support. And I mean, I think, again, this, you know, we haven't yet experienced what the mental health crisis is fully going to look like in relationship to all this. And so, again, I think access is just going to continue to be an issue, and there's got to be other ways of filling in that gap. So I think there's going to be more opportunities for solutions like MindRight to find a space in the behavioral health and wellness of underserved youth.
Yeah, and for me, 5 years from now, I hope we will have adapted quickly to the situation and be comfortable taking more risks when it comes to like non-traditional forms of care or support and meeting people where they are. We're not there yet, and I think COVID has actually shown how far we have to go. And I think 5 years from now, if we don't quickly adapt and innovate in that direction, we could have, I'm not sure I can imagine what the mental health crisis might be like at that point, because you may have communities like in Medicaid communities that are already experiencing intergenerational trauma, and what does that look like to be compounded, especially during a pandemic, and what is the result of that 5 years from now? So I'm remaining optimistic, though, that we will all adapt and move quickly to meet this need by that time.
Yeah, it's always good to end on a positive note. But before we wrap up, any final thoughts or comments on this topic, or really anything that you feel is important to get out there?
I think one thing.
Go ahead, Alex. Go ahead.
Okay. I was just going to echo something that I think you said earlier, Yavar, that I would just echo for any of the founders listening, is to really find your champion at these plans. And we've been really fortunate to have Yavar be our champion. And I think that's been instrumental for us. And so just really encouraging just relationship building and finding that person, an early adopter.
Yeah, I was just going to add on that for folks who are coming from these startups and trying to build these relationships. You do have to be patient, and there is, unfortunately, the process can always take longer than you want, I think, to kind of finalize these partnerships and contracts. And so don't get too discouraged. I mean, it likely will be multiple meetings and discussions and, planning prior to any sort of adoption. And some of those meetings may not lead to any final contract, but, I think it is a long game. And I think, unfortunately, depending on who you're looking to partner with, the winds can change very quickly, and, the risk becomes a bigger focus at times, and then the innovation becomes a bigger focus at other times. So you have to kind of be willing to sort of ride those winds of change.
Yeah, and real quickly, because we have just a couple of extra minutes, both of you have talked about finding that internal champion. And so I'm curious, this is an open question for both of you. What are some signals that the person you're talking to is the right person, that they're the one that can advocate for you internally?
Yeah, it's hard to know. I think when you're coming from the outside, you may ultimately never know who are the true decision makers in organizations, particularly large ones like payers or health systems. So, I think there are times where you may really have a local champion, but ultimately they're not the one who's going to be able to make the final decision. So I think just the longer you're kind of working and engaging with the whole leadership team as much as you can, the better sense you may have of kind of, where they're at. But yeah, I think when you're on the outside, it can, you may think you found somebody who's going to spearhead this for you, but, ultimately they're having to work through different levels of decision makers, and, they may not be able to ultimately be the final decision maker. So I think, again, just going back to being patient, and, it may happen at a specific time. Like now, obviously, a lot of folks during COVID-19 are trying to respond and find solutions. So in some ways, it does present new opportunities, but other times may be more challenging.
Yeah, I would second that. And I think for founders also being aware of when you're straight selling versus when you're engaging in thought partnership. And so we're fortunate with AmeriHealth, it was more thought partnership. We were able to creatively discuss together, like, what might rollout look like? What's the best way to structure this to move it forward? And I think us both putting in the work to do that really helped signal to us that this was the right partner for us to move forward with.
Great. Well, we are out of time, but thank you both so much. This has been a wonderful discussion, and I am so glad we were able to come together. So thank you to the audience, and we will depart. Bye.